According to the WHO, malaria remains one of Africa's deadliest diseases, killing nearly 500,000 children each year under the age of 5, with Africa accounting for approximately 95% of global malaria cases and 96% of deaths in 2021. Experts believe that annual global demand for malaria vaccines will grow to 80 to 100 million doses each year by 2030. Thanks for joining us for your program Decryptage on Africa 24 English. Today with Thabani Maphosa, Gavi Managing Director Country Programs, we will look at how Gavi, the Vaccine Alliance, is working to make it easy for African countries to acquire vaccines against the backdrop of global economic recession. Mr. Thabani Maphosa, welcome to Africa 24 English. What initiatives is Gavi carrying out in Africa to combat vector-borne diseases such as malaria?
It is absolutely the vaccination. The vaccination is the new game in town. We had a lot of tools to fight malaria up to this point, and there is a new tool that has been added, and that's vaccines. We had one vaccine and we thought maybe we're going to have that for a little longer, but we are finding ourselves in a situation where we have two vaccines, and that's a good moment for Africa.
The malaria vaccine is currently being tested in several African countries. How effective is the vaccine, and what are the perspectives in the 10 upcoming years?
We are beyond testing. We are now at scaling up. It was tested indeed in Malawi, Kenya and Ghana. 2 million children were reached during that time. Studies were done and there were periods extended to really understand the efficacy. And I can tell you that it will reduce the number of children that die of malaria, and it may even reduce hospitalizations as well. It doesn't mean that children may not be infected with malaria. They may, but they are actually in a much better place for fighting against the disease.
The COVID pandemic revealed the lack of access of medicines in Africa. What mechanisms do you intend to implement to improve Africa's ability to meet the demand for medicines in the context of insecurity and external economic pressure?
Well, I think Gavi thinks not francophone or anglophone, but it thinks low and middle income countries as a whole. So that's our frame of thinking. And in this particular case, we have subsidized the vaccine to make sure that the countries don't carry the heavier price and cost that we are seeing for now. And then we are also working on the market shaping side, which is really making sure that we match demand and supply. And as you give the suppliers better guarantees of the volumes that will be needed, the prices sometimes are better able to come down. This is not immediate, but over a period of time, we can work on that. And so now with two manufacturers, we are in a good place.
How does Gavi accompany African countries to get more access to drugs, vaccines included?
True. I don't know whether you've heard, but Gavi, the Vaccine Alliance, at its December board meeting, it approved an instrument called the AVMA, Africa Vaccine Manufacturing Accelerator, which is a very important tool of 1 billion that will actually be strengthening the African vaccine manufacturing. So through that, we are hoping that we can get into a space where Africa can contribute to the manufacturing of its own vaccines.
What role do new technologies such as artificial intelligence and telemedicine play in transforming Africa's healthcare system?
I mean, artificial intelligence can be used in a broad range of things, but I'll stick to what I know, which is immunization and in that space. You would be aware that in December, here in Cameroon, the level of vaccine hesitance was so high. And when you can use artificial intelligence for social listening to really understand at a granular level what are the problems that people are dealing with, you may actually be in a better place to create better awareness, education, for them to actually understand and to remove the barriers that are there. But also with artificial intelligence, the generation of the materials to actually engage is even much faster. So the speed at which you respond to issues and you hear issues is much, much faster. And so the bottom line is artificial intelligence is actually shortening our times of response. It's shortening our times of listening and hearing what the issues are. I think the world is big with artificial intelligence. But there's the flip side as well. It can be used for things that are not appropriate as misinformation. And so we have to use it for good.
Mr. Maphosa, thank you very much for answering Africa 24's English questions. Stay tuned to our programs.